Hello, I'm Morgan, and welcome to our podcast with Cheer Healing the Gap. Today, we have one of Cheer's fifth round pilot awardees, Dr. Erica Kelly, to talk about her research and experiences and reflections working with the CBRN and the center. Dr. Kelly, we would love for you to introduce yourself. Who are you? Who do you serve? And then we can get into the specifics of your project.
Sure. So I'm a clinical psychologist in the OB/GYN department in the Department of Urology at University Hospitals and Case Western Reserve University. I'm an assistant professor in those departments. So I am about 80% clinical and 20% research. And so I serve pretty wide range of population, but I partly work within our gender care services. I work in our fertility clinic. And I see individuals for, again, kind of a variety of concerns ranging from sexual dysfunction, perinatal mental health, general mental health. And as it relates to the study that we'll talk about today, I speak with individuals who are seeking gender affirming care. So I support them in their care and their general mental health, but also work with them for their mental health referral letters for gender affirming medical intervention.
Thank you so much for sharing that. I also know from reading your bio that you also have worked with Dr. Rachel Pope as well
Yeah.
in her
Yeah.
research, which is I love to see the collaboration amongst the physicians, especially physicians who also are pilot awardees too. So that's kind of cool to see the connections within the program. Could you give us like an overview of your study, and also maybe include like where you're at right now within the process as you complete it?
Yeah, so this study, I like to think of it now as one piece of kind of a larger program of research and work that we're doing broadly to look at reducing barriers to healthcare among gender diverse individuals. So it's kind of the broader scope of this work. But this project in particular, we are looking at essentially cancer screening guidelines and the barriers to accessing cancer screening among gender diverse individuals. And we are also looking at the possible role of social media as a tool to help improve cancer screening uptake among this population. So I'm sure you know there's a really huge healthcare disparity experienced by gender diverse folks. And we also know, unfortunately, that cancer health is very under-researched in this population. And so our aim really is to start to better understand some of those barriers. And we're looking at this shared decision-making model, which is used in healthcare to help, inform and support individuals' experiences and decisions as it relates to healthcare. And part of that is really empowering the patient. And this is a patient population who, right, is very vulnerable and has experienced a lot of discrimination and stigma in healthcare and barriers to healthcare. So again, overall, we're trying to understand barriers to cancer screening uptake and looking at the possible role of social media in improving cancer screening uptake. There's two phases to the project, and I think this is a great time actually to talk about it because we're kind of in the midst of focusing more on phase two, and I think I can kind of touch a little bit on like how the project has evolved a little bit, which is I think directly a part of working within the CBRN and doing community-based participatory research because I come in with this perspective as a clinician and as a researcher, and I have this one idea, but that idea when we originally put together the protocol was not really being inclusive of all of the experience of the community. And so I think that's been really nice in helping to shape the project over time. So very briefly, we have two phases. Phase one was a series of in-depth interviews that we conducted with gender diverse members of the community. And we also interviewed healthcare providers who work in primary care or cancer care. So we wanted kind of both perspectives in terms of what is the current status of cancer screening in this population? What's the access to knowledge and information about cancer health and cancer screening? What are the barriers and what can we do to improve cancer screening uptake? And our community partner is the LGBT Community Center of Greater Cleveland. And so we've been working really closely with the center. And our second phase that we are in the middle of right now is doing an online survey that looks at this in a little bit more in depth. So we are sending the survey out. We hope to recruit about 100 individuals who identify as gender diverse. And the focus of the survey is really on, again, like understanding cancer screening attitudes, barriers, intentions. What are really the factors that are driving decision making related to cancer screening? And is there a way that we can increase cancer screening using social media?
I really, well, first of all, I think this is a really cool and interesting project in the sense of um, viewing social media as a tool for like public health and education. So kind of a little follow-up question. What has led you guys to think of and turn to social media as a tool to potentially use for cancer screening for this population?
Great question. I would say several factors. The first is anecdotally, in my professional experience as a psychologist, I have been seeing increased people say in my practice to me, I saw XYZ on this social media platform, right? And I saw this mental health tip or this mental health information, this healthcare information. So I just personally have seen a huge increase from the individuals that I see in my practice in terms of how much they're turning to social media for health related content. So that was one factor. And I'm sure you can imagine, the COVID pandemic, I think really did um,
Mm-hmm.
contribute a little bit to that surge. So that was one factor, was just sort of based on some clinical experience. The other aspect of this is that decision was seeing some of the research that gender diverse individuals often do have to turn to their peers for healthcare information and support and decision making, right? We see again that there's a lot of barriers into getting into general primary care and in healthcare settings. And so if they can't get the information there, they're probably right. Where do you turn? You turn to your support of others and your support of peers. And social media is one way that that can be done. For example, in some of the support groups that are online. And so those are, I would say, the two factors that really led us into looking at that more.
Mm-hmm. Okay, no, that makes a lot of sense. I recently had a conversation with one of my friends, and she like referenced like YouTube University or like how like yeah, forums like Instagram and things like that, like it's so easy to make an infographic. Like anyone can do that, and it's so easy to just like pass it along
Mm-hmm.
um to your friends or just mutuals that you have in your network. It makes information sharing just way more accessible and easier. It's free.
Mm-hmm.
Mostly everyone has access to it. So that makes a
Mm-hmm.
lot of sense.
Mm-hmm.
Um, and something else that I've noticed as well is within the center, not related to social media, but how it seems like there's so many more projects or studies centering sexual and gender minorities and gender diverse communities now than ever. And it's really encouraging to see um, people who are clinicians or people who are PhDs or um, coordinators and everyone within the research community really giving space to that community and prioritizing their health and recognizing their disparities and seeing like okay like what are the steps and like finding those like intersections. Like I would have never thought that there would be disparities within cancer screening
Mm-hmm.
amongst sexual gender minorities and gender diverse people, but then once you explain it and you lay it all out, you're like that like why didn't we see that? That makes so much sense.
Mm-hmm.
um
Mm-hmm.
so it's so good to see that being put forth by a great group of people. um and then kind of shifting gears just slightly, I always like to think of these conversations as kind of like moments of reflection. And I know as researchers, a part of the role that's a little understated to people outside of research is the importance of reflection of your work, what you've done, what you're trying to do, and how your sense of self and your background plays a role into all of that. So I guess we can have like a little mini reflection. I guess this is what this is. Um, what has the process been like building your relationship with your community partner, the LGBT Center?
I would say that's been the most personally and professionally meaningful in this project is really what I have learned in the humbling experience I've had. I'm a cisgender white woman, and I have become, more and more aware of my privilege in that and working in the position I do in healthcare. And so um, one thing that I have really noticed in this project and learned from a reflection standpoint, and that I think really is starting to show up in the results of our data, is this idea that we as clinicians will really only see who's coming in the door, right? So my experience as a clinician is who can actually get to the point of being in healthcare. So that's what's shaping my perspective, right? And I have made the mistake of generalizing that to an entire population, and that is not fair and not accurate. And so it's something that we have seen. I told you we, have interviewed both healthcare providers as well as members of the gender diverse community. And I think that's really something that showed up is there were some discrepancies. Healthcare providers were so excited to help, and sort of, I think there's become a little bit of a misperception that the only issue is access. So if we, let's say like just bring the cancer screening to the LGBT center, then everybody's going to want it. And the reality is that's not true. It's not just about access. One of the things that has shown up that, again, for me has been very eye-opening and humbling is for many individuals, the idea of cancer screening is really outside the realm of possibility for many reasons. One of the reasons is they're focused on survival. They're focused on living their authentic self, that it's just not a priority to think about cancer health. And for some individuals, there's been an expression that it's almost like a privilege to be able to think about cancer health as a whole package of preventive, healthcare in cancer screening. Um, an individual had mentioned, it's sort of akin to thinking about a college education. Like the idea, I don't get to think about that. That's just not my experience. And so part of this experience is showing me, I think, the importance of building hope and trust in our medical community and really, again, like kind of looking at the big picture. And it's not just about bringing the cancer screening, to an individual. It's about thinking about why would they want to do that? How is that important to them? How can we make their lives better overall so that that becomes an available priority to them? So really, again, like there's just been so many humbling aspects about this project. So one of the things that we have seen so far in the survey data, and we are halfway through, so it might change once we, see the full sample and have a larger or more power, is that 50% of the sample believe that they are likely or extremely likely to get cancer. Okay. And then when we look at different types of cancers, we look at oral cancer, we look at lung, we look at cervical, we look at colorectal. We're looking at a few different cancer types. When you look at the rates of who has received screening already, and if they haven't, do they plan to? Almost 50% of the people who haven't had screening don't plan to. So you have 50%, right, who think they're going to get cancer, but most of them won't get screening or haven't gotten screening. So I think, again, it's a data point that really highlights we need to focus more on, the hope for a positive future and the more holistic view of health. It's not just about the access, it's about, building the hope and the motivation in many ways. So, again, I guess long story short is it's been a very, humbling experience for me because sometimes I think, I get so excited about engaging in healthcare and think everybody wants it. And if we could just give more of it, we would be helping so many more people. But really, I think we have to think more holistically and broadly about how can we better serve our community.
Mm. No, yeah, like thinking of like the difference between like access and like true accessibility and And I think the part you mentioned about hope, I know it's been a topic of conversation within Cleveland for a while that this is a really dangerous place for trans individuals and gender diverse individuals. And so I think it was mentioned during like our CBRN meeting, like when your life expectancy as a trans person of color is only mid 30s, then cancer screening is not a priority. It's the survival, like you said, and like having to having to build up and create better resources for overall health and well-being for the community is will then uplift like other parts too, like cancer screening, like you said.
Mm-hmm. Mm-hmm. Yeah, I agree, right? We need to really decrease discrimination, violence, stigma. I mean, and these are all factors that affect health. And I think that I guess that's the other piece that's been humbling. A reflection point for me is better understanding the importance of advocacy as a researcher and as a healthcare provider. Um, I think that's been really important for me to better understand.
And I think this segues really well into um, kind of my next question for you, which is how has the research, either the content, but also the process of developing and putting forth this study informed your practice and your relationship with patients, but also like how you collaborate with other providers.
Mm-hmm. Mm-hmm. I think there's been several changes, and I'm sure there's going to be, more to come. As I mentioned, this is, reducing barriers in general and improving health among gender diverse individuals is a, broad interest of mine, larger interest even beyond, cancer care. Um, so several things. One is really, really being more aware and connected to the community. I mean, that's been, I think, number one. It's interesting working in a hospital setting. I'm so familiar and aware of my colleagues within the hospital setting. Um, and it's really, really important to know about my whole community and what community agencies, what community supports exist. Because again, when we're looking at holistic health, it's not just about being able to get to a therapy appointment, but it's thinking about all other aspects of social drivers of health and sources of support. And one of those things would be, hey, do you know about the LGBT center, right? How can I get you connected? How can we find you some additional sources of support? So that's been, one focus of mine that I've noticed over time through this project is just being more aware of staying connected to the community. And recommending community-based resources. So that's been awesome. And I would say that's part of the CBRN is I've learned so much about what community resources exist, and I'm making so many more referrals to community-based agencies. So I've loved that aspect, and it's really increased my collaboration through the CBRN too. Is just seeing kind of all of the overlap that's that's happening between different projects and ideas, and looking at health disparities and different community agencies, just like the general collaboration between hospital, academic, and community-based agencies has been really awesome. The last thing I'll say too is it's been really helpful working in this project in terms of other work that I do in this area. So I sit on a committee for the International Consultation of Sexual Medicine, and we're putting together a consensus document on sexual function among gender diverse LGBTQ individuals. And so my experience on this has really shaped my input into this project, and not just looking at clinical data, but really looking again kind of at this holistic view. So I'm excited to just learn more and see how the work that gets done through CBRN and community-based participatory research really shapes our future in healthcare.
Thank you for sharing that. As you talk about, obviously one highlight and great part of the project so far has been the relationship you've had with your community partner. Kind of shifting gears a little bit, what have been some challenges that you faced while working on the study and how you've been able to overcome them. I know every research study comes with its challenges in all essence. And I think anyone who's been involved in any human subjects research or just like in the thick of bureaucracy or hospital systems knows there's a lot of navigation that needs to be done. So definitely would love to hear about some things you've had to overcome so far.
Yeah, I would focus on two things. So the first is a little bit more on kind of the regulatory side of things. So when you do a research project, you have to have it approved by an institutional review board and make sure that you are being ethical in your conduct of research. And so going through my IRB, of course, I have to follow all of these protocols and procedures. And so one of the things that came up that became a challenge was for us to be able to do an informed consent process through the internet. So through doing, a virtual interview, we have to be able to confirm the identity of the individual for them to sign a consent form. So the what was the existing process was I would have to ask the individual to show me a government ID that shows me your name and your gender and your date of birth and XYZ, right? And so can you imagine how triggering that can be for some individuals? And so that was not going to work for this project. And so really, I'm so grateful our IRB is so understanding and we're constantly thinking about being ethical in our practice and being aware of diversity and inclusion. So we were actually able to change the regulatory process for the e-consent so that we did not have to ask for a government ID. And all we had to do was have the individual confirm with us that they met the inclusion criteria and they did not have to tell us about their dead name, or anything like that. And so that was an awesome, I think, hurdle to overcome. It was, just thinking about like, do the regulatory processes we have in place for research, do they actually work for everyone? Maybe not,
Mhm.
right? So that was really awesome. The other piece that I would say is, I'm a psychologist and mental health provider and can get overwhelmed with clinical work. Um, we're very, very busy, and sometimes it's hard to find that protected time to do research. Um, at the end of the day, it's difficult to do that. And so what has been my tendency in the past is just try to get everything done myself. And I am so grateful for this CBRN and for community-based participatory research because it's showing me so much more the value of collaboration, right? And teamwork. Teamwork is so important and so helpful. And so I was putting so much pressure on myself to kind of do everything alone. And I was feeling sort of siloed, but this is allowing me to feel so much more, supported and to be able to learn from other people. And things are so much more efficient and so much more successful in research if we can collaborate. And so that's been something that's been awesome is having a bigger team to work with is making this project successful.
Mm, yeah. To your first point about the the having to really think about like the structure and rules of, IRB and IRB protocol. I think that's so interesting because they obviously like the reason we have an IRB and the reason we have these boards in place is to protect patients. And then there is like that moment of, oh, like these rules we have in place, like that was their intention, but in actuality, it's actually a huge barrier for certain communities and individuals to be involved and thus is detrimental in the long run. And like
Mhm.
it's one thing for us as researchers to be like, oh, like the IRB is making me do this or I
Mhm.
can't do this because it's like we tried to get e-consent and it was like a whole thing we couldn't. So we had to like physically mail our consents and they had to sign them. And they would have
Yeah.
pre-stamped envelopes for them to put in and mail back to us. And like that puts a lot of the onus and the burden on the patient to participate
Yeah.
in the project and like how can we make it as accessible as possible.
Mhm.
And I'm glad that that was something that you guys were able to figure out with the IRB. And that was also something that they were like, oh, yeah, like there was that reflection point of wait, maybe we
Yeah,
should maybe we need to make some exceptions sometimes to this
yeah.
to get people in and let people do what they need to do and make sure voices are heard and people are comfortable sharing what they need and want to share.
Hmm.
So that's great to hear. Like actually I'm like, whoa.
Yeah, and really, I think part of that is just asking, right?
Yeah.
Like another, it's hard. Sometimes it's scary to ask these larger bodies and regulatory boards and things like that.
Hmm.
But like, I think, try also kind of back to that hope idea, right? Like, I think many of us share the same intention to try to make things more accessible. And so, yeah, that was a very awesome experience.
That is good. I like that. And then two, I feel like this whole interview, we've kind of been like sprinkling in like the CBRN. And so I guess my last grand question is like, what has been like the impact of like our CBRN space, our monthly meetings for like you and your work and the study?
I think I might have a lot of answers to that, but I think on theme, I would say one of the biggest impacts for me has actually been hope. Like you said, sometimes you run into these roadblocks in doing research because there's a lot of, regulatory aspects to it. Want to be very meticulous. It's a lot of effort and work. And I honestly do it because I love it. I don't have to do it as part of my job. I just love to do it. And so it's really the hope. Like when I get on and I'm on the meeting and hearing what everybody else is doing and like the challenges they've overcome and how absolutely supportive everybody is, like we go in and it feels like there is equity and equality like on the network itself. And so that has been very, very inspiring. So I think it's like the hope and inspiration that I get that keeps me going, when I have the frustrating times and I'm just thinking like, oh my gosh, this project isn't even going to be possible. It's never going to happen. We're just going to keep running into barrier after barrier. But then I go in there and everybody is so supportive and helpful and help problem solve and just hearing what they've done. It's been very supportive and inspiring in that way. So that's been, I think, one of the most impactful experiences for me.
Yeah, it's like a monthly like gulp of like crisp cold water once a month.
Yes,
You're
yes,
like, oh, yes.
I come out of it, feeling that meeting, like feeling just so energized and excited and also just so in awe of the work that everybody else is doing and the passion that everybody has. I mean, it's so inspiring.
Yeah. There's there's a lot of there's a lot of special people that come to those meetings and the fact that there's all these people who take the time out of their day to come and like share this space and this time I think is so important and all the passion around everyone's project and the causes. It's like, okay. And the fact of like, we talk about, like health equity within, our practice or our research, but then to also see that practiced in a space like that equity and collaboration that we talk about wanting in our research, we also practice in a space where we talk about it too. I think is
Mm-hmm.
like super cool and important.
Mm-hmm. I love it. Yeah. I hope I can go every that one Thursday of the month for the rest of my career.
Get like a little lifetime membership, CVR forever.
Exactly.
Oh my gosh, this was such a great conversation. I really, really enjoyed talking to you, and I really loved kind of like you said, like that. We did kind of have that theme of hope in our conversation and hope and research, which are not two things you often think go together. A lot of times, you never think of like needing hope and research,
Yeah.
but you do sometimes. And like how that important that is, not just for you, but like your community and I think that's hope is something that we always all owe each other. So
I love that. Yeah, very true. And it's so important to resilience.
yes,
Um, and I appreciate the opportunity to be able to talk with you today. This was great.
thank you so much, and thank you to our listeners. Sometimes I forget they're there because we're so engrossed.
Yeah, right.
But yes, thank you, Dr. Kelly, for joining us today.
Of course, it's my pleasure.